Welcome to my video series on cardiovascular disease, where I'm offering new perspectives for your cardiovascular health. This is topic number 3, and the topic for today is risks of statin drugs. Statin drugs are cholesterol-lowering drugs and is the standard drug prescribed for cardiovascular disease. This is Dr. Ellen Rencher, and if you're not familiar with me, I am a clinical nutritionist in functional medicine, a chiropractor, and I began my career in cardiac rehab as an exercise physiologist, and I was a cardiac rehab director in New York. Now, some of you may be taking statins or told that you should be taking a statin, and you may be questioning whether this medication is right for you. No one is happy when they are told that they need to take a medication, especially one like a statin, which they may need for the rest of their life. It's an expensive drug, and all drugs have side effects and risks. But we have been told that statins lower our risk of heart disease, heart attacks, and strokes. So it's a big decision whether you're deciding to take a statin or stop taking the drug. I've always believed that knowledge is key when making such decisions. In this video, we will review the risks of statins that are often not mentioned on advertisements or even by your doctor. So first, how do statins work? Your liver makes 80% of the cholesterol, only 20% comes from your diet. Your cholesterol can vary up to 100 points throughout the day, according to what your body needs. Things like stress or injuries can increase your need for cholesterol. Statin drugs interfere with the production of cholesterol. Statins will successfully lower and keep your cholesterol low throughout the day. So then the question becomes, if the amount your body needs varies, what if your body needed more than the statin permits? Let's talk about the common side effects. Often I have patients that come in complaining about muscle aches and pain, and that could very well be a chiropractic case in which when we adjust them, the pain subsides and the function of their back or whatever area in their extremities, such as shoulders or knees, repairs. But if the pain continues and I'm not really seeing any signs of injury, it may be something like this. And many patients aren't aware that one of the side effects of statins can be muscle aches and pains. Other common side effects are headaches, feeling sick, feeling unusually tired or physically weak, dizziness, low blood platelet counts, and these usually arise within the first year and are relieved if statins are stopped. Now let's talk about the more serious conditions that may arise from taking a statin. Statin risk number 1, coronary artery calcium. The study compared statin users to non-statin users that had similar LDL, bad cholesterol, levels. The group of statin users had significantly higher rates of calcium in their coronary arteries. Now, why would this happen? Well, if you recall from my cholesterol video, I mentioned that the LDL cholesterol are the fire trucks that rush from the liver out to your damaged arteries to do the patch-up work on those damaged arteries. Statins decrease the production of cholesterol, so fewer fire trucks are available for the repair. Your body is always repairing or searching for a way to repair. If there's a shortage of cholesterol for the proper repair, your body has a backup system. And here, your body will lay down calcium to protect your arteries from the harmful flames of inflammation. And now you have cement or calcium rather than cholesterol, which would actually repair that wall and it protects it from the inflammation, but now you have a much bigger problem. Now you have what's called arteriosclerosis, of hardening of the arteries. This creates a loss of flexibility in your arteries and increases blood pressure. Statin risk number 2, increased diabetes for women. In a 3-year study, 71% of women on statins were reported to have an increased risk for diabetes. And that combines that 71% pre-diabetic or diabetic, as compared to women not on statins. And there was a very strong 48% risk of actually getting diabetes, even after they took into account age, race, ethnicity, and weight BMI. These statistics were consistent with all brands of statins. Now, here's the breakdown of women actually getting diabetes while on statins. For white women, 49% of women became diabetic in this 3-year study. For Hispanic women, 57%. And for Asian women, 78% of the women taking statins in this 3-year study became diabetics. For men, there was a 6-year study in Finland on men ages 45 to 73. Now in Finland, diabetes is not as common as it is here in the United States. And they found that those on statins were 46% more likely to develop diabetes. In other studies in the U.S., they reported 39 to 43% increase in diabetes while on statins. Statin risk number 3, strokes for women. In April 2019, a study was published in an issue of Neurology. Women who have low LDLs, lower than 70, are twice as likely to have a hemorrhagic stroke than women with LDL levels much higher at 100 to 130. Remember, LDLs save your arteries, and the highest percentage of cholesterol in your body is in your brain. At an American Heart Association conference, a report was presented that people with cholesterol levels lower than 180 doubled their risk of hemorrhagic stroke compared to cholesterol levels of 230. This was also supported with studies published in the Diabetic Institute in 2020 and the NCBI in 2020. Statins causing very low cholesterol levels will increase your risk of having a stroke. Statin risk number 4, neuropathy, or also called polyneuropathy or peripheral neuropathy, which is pain, weakness, numbness, and tingling in your hands and your feet, often causing difficulty walking and can increase your risk of falling. A study of 500,000 residents in Denmark reported that after 1 year of taking statins, the risk of developing polyneuropathy was 15%. After 2 to 3 years, the risk increased to 26%. The damage is often irreversible, even after stopping the drug. Remember, cholesterol is the material used to cover your spinal cord, your brain, the nerve endings, and your muscles. So it makes sense that this could possibly happen as a risk of getting your cholesterol lower than its needs. Statin risk number 5, heart failure. Death due to heart failure doubled in 1989 to 1997. Researchers believe it was due to the interference of CoQ10 production by the statin drug. The heart muscle cannot survive without CoQ10. Statins continue to deplete your body of this nutrient. So it's very, very important. If you are taking a statin, you must take a supplement of CoQ10. We will discuss supplements and which ones are best to take in the next 2 videos. Statin risk number 6, cognitive impairment. A study conducted at the University of Pittsburgh showed that those treated with statins for 6 months tested poorly compared to patients on a placebo in solving complex mazes, psychomotor skills, and memory tests. Also, a study in Melbourne, Australia, reported women ages 52 to 63, they had higher levels of LDL, were associated with better memories. Again, cholesterol is needed for your brain and for the speed of neurotransmitters. Statin risk number 7, depression and suicide. A study of 29,000 men were found to have an increased risk of depression, suicide, and violence with low cholesterol levels. Another study found women with low cholesterol were twice as likely to suffer from depression and anxiety. Again, your brain and neurotransmitters, dopamine and serotonin, need cholesterol. Statin risk number 8, muscle aches and pain. Now, this goes beyond the average side effects. Damaged muscles will increase the release of creatine kinase, or CK. Higher levels of CK are seen with statin users. The statin studies did not report muscle damage or aches with statin users unless the CK levels were 10 times the normal level. So in their studies, muscle aches and pains may not actually be listed as often because they had to be 10 times the amount of normal. Patients that had their doctors take them off statins noticed reduced muscle aches, cramps, and pain. Now, there is a condition called rhabdomyolysis, which is a condition of inflamed, damaged muscles that releases its proteins and can cause acute kidney damage. And so I wanted to mention this because while you may have a blood test of CK, and your doctor actually may do that test, but if you are having symptoms of extreme fatigue, feeling weak, you have dark urine, muscle cramps, aches, and pains that are more severe than expected, then you should go to your doctor and have the CK level tested because it can cause acute kidney damage. Okay, statin risk number 9, muscle tears and ruptures. Multiple studies have shown increased risk of tears and ruptures of skeletal muscles and tendons, such as Achilles tendon, bicep tendon, quadricep tendon, shoulder tendon ruptures, and even trigger finger. Cholesterol is needed for the tendons, muscle cells, and fascia, the sheath that covers the muscle. And here we are seeing that low cholesterol levels lead to a higher risk of muscle tendon tears and ruptures. It seems that statins are not the wonder drug the marketing team would have us believe. Fats are needed to balance our sugar levels. Cholesterol is a fat, and now we're seeing how lowering that fat level has greatly increased the risk of diabetes. In addition, the LDLs are needed to repair the damage in your arteries, feed your brain, your nervous system, and muscles. By depleting your body of the materials that you need to repair, you can see how the low cholesterol levels can create havoc. I hope you continue to follow this series to learn how you can turn your health around. If you'd like assistance in lowering your risks and improving your health, I'd be happy to help you. In our next 4th topic, I will reveal the nutrients depleted from drugs that you may be taking. This is Dr. Ellen Rencher, and thank you for joining me today. I'd love to hear your opinion of these videos. Be sure to subscribe to my YouTube channel here to be notified when our next video are up for you to view. Thank you and have a lovely day.